Everyone, it's Dr. Svehlak. Today I want to review a little bit more about facial balancing, facial symmetry, and so on. And so there's a lot of different treatments that we can actually use. The first thing about is, what are we evaluating? So when it comes to facial balance and so on, we want to evaluate different layers. We want to think about the bone. Some people have asymmetry in the bone structure. Maybe part of their brow is more prominent on one side, or one cheek is bigger than the other, or even a retruded chin. So we got to think about things like this. So we think about the bone. The next layer, we think about the muscle, the movement in the muscle, the movement, the facial expressions, the winking and the smiling, there could be asymmetries in those. And then finally, at the very surface, we think about the skin, wrinkles, extra looseness on, say, one side of the face, or extra fullness on one side of the face or the other. So ultimately, we want to kind of balance everything. So some of the things we can think about when it comes to facial balancing, one of the first things is very simple, is if there's some asymmetry, say, with the muscle movement, then we think about neurotoxins such as Botox. Say, if one side of the brow is higher than the other, then we're going to adjust our dosing and placement of where we may put Botox. Let's say we're thinking about the frontalis being more active on one side, so we want to put a little more Botox on one side to kind of keep that in balance. Or if we need to create more lift, we may want to think about putting neurotoxin in, like, the upper crow's feet, or the corrugator muscles between the brows, say here and here. We want to put some in there. That's all going to help lift and create more balance, and even more, kind of just making you look better and less lines. We also think about neurotoxins, say, in the lower face. If you're, frowning is a little crooked, we can place more Botox, say, on one side versus the other, weaken the depressor muscles to see if we can increase or improve the symmetry. And same thing into the neck. Some people have a lot of people get these platysma bands, and they show more and more as we get older. And so we may want to treat one side with neurotoxins more than the other to help weaken that, make this neck look a little smoother and a little more defined. So that's thinking about muscle. Now, the other next thing we think about is, contours. If, let's say, one temple is more hollow than the other, then say we're going to put some filler in the temple. Say in this area, we want to fill a little bit, or fill a little bit on this side. Another good option besides fillers, which are readily available, just using your own fat. Doing a little fat transfer, we harvest a little fat, a little mini liposuction, we place that fat into these areas. Other areas that are very common is the forehead. Sometimes foreheads can be asymmetric. One side will be a little flatter or more hollow than the other, and so we want to balance that out by maybe even placing filler throughout the forehead, whether it's on one side or on both. And then we kind of work our way down, and we think about the crow's feet, again, with neurotoxins, maybe under the eyes. It's more hollow on one side versus the other. So we want to try to create more symmetry. Again, maybe filling tear troughs, or maybe putting a little bit more in the cheeks. Again, this can be any number of fillers. It can also be your own fat. So this all works well. And as we come further down the face, we think about the marionette areas and nasolabial folds. Maybe we need to fill those a little bit, make them look a little bit smoother. Maybe one is deeper than the other. Like, as you can see here, my left side here looks a lot deeper than my right side, is very common. And so maybe we would end up putting a little bit more in this left one and a little less on the right one. And then we think about the jawline. Again, there's a lot of asymmetries in the jawline. Sometimes the bone can be more prominent on one side versus the other. Again, we can work with balancing that by adding filler to one side, possibly adding a little toxin to one side of the masseter to make that masseter a little bit less projecting, starts balancing the lower face. And then we think about proportions too. If someone has a retruded chin, we may want to build that chin up. Other things beyond fillers and neurotoxins, there's surgery. There's surgeries to help lift the brow. Maybe we need to lift one side more than the other, so we're going to create more of a lift on one side versus the other. If there's asymmetry in the eyelids, we got to adjust that with some kind of blepharoplasty surgery. And as we come down, you may have issues with one side having more jowls than the other. So again, now deeper, we're thinking more aggressive procedures, facelifts. Maybe we need to pull and lift more on one side versus the other. Into the neck, same idea. And then finally in the chin, if we want to build up the chin, we want to make it more symmetric, we can use fillers. And finally, maybe just a chin implant. A chin implant can really help improve the jawline, sharpen the jawline, fill the pre-jaw hollows, and also give more projection. So in terms of facial balance, it's more proportional throughout. So there's lots of techniques we could use to improve facial balancing. Um, it could be something very simple. It may be more complex, but there's a lot available. And I think the most important thing is go to somebody who really has a lot of experience with this, understands the anatomy, understands the nuances of the different treatments, and then discuss it with them and see if facial balancing type of procedures are really good for you.